So, doctor, first of all, I am really curious and I want to understand how did you come up with this idea about dental toast?
There were many triggers, but one of the triggers was the consequences which are faced by by the dental patients due to late diagnosis of their conditions. Now, for example, I have personally dealt with a lot of oral cancer cases where we know the outcome or the quality years of life are not being provided to a patient just because of diagnosis which happened in stage 4 and 5. Also, with respect to consequences for their heart tissues, now we know that oral caries are not reversible. Although we can reverse gingivitis at some point, but it's always best to have a preventive and a holistic approach towards oral health and deeply understands its impact with the overall health, which everybody, especially the patients, have very superficial knowledge of the same. And it's not their fault either. If I look back, all the diabetes and the cardio related momentum which have started among laymen were due to constant bombarding of required knowledge and the wisdom. Because if you execute that knowledge, only then it turns into wisdom. Otherwise, what's the point of knowing things but keep doing wrong stuff, right? I have been constantly bombarded on people, and now they are taking, all right, I should be exercising in order to prevent, say, heart attacks. I should be having this right balance of my diet to prevent diabetes. But those kind of bombarding of a depth is not yet done with the dental fraternity. Multiple reasons again, but I think if we make use of technology, and we are in an era of AI, where so much of manual stuff is been taken care by the machine, we have the golden chance and more than ever before to let this information out to people, and which was the exact point when I had in my mind when we started DentalDost, that a lot of education and awareness is been done in other fields of healthcare barring dentistry. So why do we leave it behind? Why do we only, as dental surgeons, focus on corrective and cosmetic side of things? Why do we only wait for a tooth to decay so much that we have no choice but to tell a patient you only have to go for a root canal treatment or an extraction? We know all of these could be prevented, but are we putting in a proper structured format to give it to the audience? Maybe no. Let's give it a try. And that's how it started.
Okay. That's actually an inspiring journey because the kind of things which you are saying is so true. People are not aware about those things and they are hesitant also to an extent to go to meet a dentist if they are having issue until and unless it's something which they can't bear. Only then they'll visit. But the problems of the dental happens to be much more than the teeth. It affects the heart, it affects other things, and people should be aware of that. So that's a great kind of, I think, journey which you have started. And I would really want you to just sum it up and let the viewers know and understand that what does a dental dose do for a patient and a dentist?
It's a very seamless journey if we are to bundle in a structure for you viewers and dentists to understand what exact are the touch points and how is the workflow. So as I mentioned, let's first understand the problem, which is not being enough aware and educated of oral health. If you are not being motivated to take the right steps, and even if you are motivated, in certain regions we know what is the situation with respect to a balance of number of dentists versus patients. And even if they are aware, educated, and motivated, they may not get access to early appointments or even early screening for that matter, right? And consultations. What's happening in the UK? What's happening in India? First three elements are missing. No awareness, no education. What's happening in the MENA belt? Maybe somewhere a balance of there is awareness, some insurance is covering in certain regions there is no insurance. And again, people think the teeth which are visible in the front should be good and in the back it's okay to have anything. This is a correct, कोई फर्क नहीं पड़ता. So solution for that problem is number one, being aware of the situation, what is happening in your oral cavity as of now, as of today. Pain or no is secondary, but at least be aware of how many teeth do you have to begin with. People don't even know that, right? What's the count of your teeth? It's like, I don't know, third molar hai, nahi hai, whatever.
Yeah, right.
How many are diseased, non-diseased? What's your oral type? If you are following a good routine with right products or not. So for that, the solution which we have for users is simply scanning your oral cavity through your smartphone. Right? So you do this action, front, upper, and lower. That's all. Within 5 to 10 seconds, you get a preliminary screening report of your oral cavity covering all the things which I just mentioned. Post that, the first level of awareness is now created. All right, I have these many number of teeth, and oh, I have 4 patent fissure caries which are not hurting right now. But if I don't get fillings in time, it may end up in a deep caries, and I may have to go for a root canal or extraction. Better get the filling done in time. Or even before that, a child whose oral cavity is scanned by the parents, they would know, all right, my child has, say, deep fissures, right? And we can avoid cavity by sealants. Correct? This is all happening sitting at their comfort of their home in the comfortable chair and not the scary dental chair, right? So this is first workflow where a user is scanning. Later, for consultation, he can immediately book an appointment to discuss more about the report which has been generated with our partners. So in the regions outside India, we have partners. In India, we have an in-house team of dental surgeons who are available round the clock 24/7 to help them with consultation. Third step, now a user know, all right, habit-wise, my oral type is, say, general oral type or dry oral type or bleeding oral type or malaligned prosthetic oral type. People don't even know their oral types, which they would know after the scan. I should be using these products. Habits is sorted. I should be using, the habits is sorted. I should be getting my cleaning done because it has been 8 months, 12 months, whatever, will come into hygiene. And I require 4 fillings or 2 sealants because of what has come in the scan. Now he needs to go for a treatment. We have partner clinics across the country, and we are also now extending in the other regions where these people get the treatments at our partner clinics. And the partner clinics also have received the information about the patient scan, medical dental history, because he has already been consulted. They do provide the treatment. After providing of the treatment, post-treatment scans are uploaded on the app, where a user in real time can see, all right, my score was 4.6, and now after taking these steps, it has come to 8.5. The best is till 10. So now I need to maintain my oral cavity, and by using the right products, I can maintain the level of 9.9 or 10. So I hope this sums up the entire flow, right from not knowing anything to getting all the right steps done, and not just stopping there. Keep remotely monitoring your oral cavity by regular scans.